extra 10 billion over the course of 6 years. I don't think that's the same as saying we're getting more than we asked for over 5 years, because it was a 5-year forward view, not a 6-year forward view.
Well, Stephen Dorrell chairs the NHS Confederation. He is a former Conservative Health Secretary, and he joins us from Worcester. Good morning to you.
Good morning.
We heard the Labour leader Jeremy Corbyn accuse the Prime Minister yesterday of being in some degree of denial about the NHS. Do you think that that there is an element of truth in that?
Well, I think there's a tendency for this argument to degenerate into a blame game, which is very, very unhelpful, both to the hard-pressed staff of the NHS and, most importantly, to the people who rely on its services. And from the beginning of the 5-year forward view that Simon Stevens mentioned in his evidence yesterday, he has made it clear that the NHS can only do its job as a key public service if other public services are sufficiently well funded to be able to do their job, which is why there's been a continuous discussion over the last several months about the importance of properly funding social care and indeed social housing, supported housing units as well. Because if those services don't work, then the people whose interests are undermined by that fact end up within the NHS. Properly funded public services isn't a matter of funding one silo and leaving the rest. It's a matter of funding the full range of public services.
So the reports we are getting that Number 10 is irritated by Simon Stevens, the head of the chief executive at NHS England, of his approach, that they are irritated by political interventions, including the idea that there should be proper payment for social care. That's unfair on him, is it?
Well, I do think it's unfair on him, yes, because he's made it clear from the beginning. He set out. He is the author of the 5-year forward view. He is the author of the government's policy of the health service as part of a broad range of public services, and he's been the strong advocate of the need to integrate, to change the way we deliver health and care in our communities in order to deliver more joined up services with a proper emphasis on care as well as on the essential elements of acute medicine.
But when you look at how we decide how much should be spent on the NHS, the former Treasury official Nick Macpherson tweeted last night, look, Simon Stevens is a good guy, but he should not be determining health spending. The NHS is a bottomless pit and money should be linked to reform.
I agree that money should be linked to reform, and that's why Norman Lamb and I, on a cross-party basis, including Alan Milburn from Labour background, have been arguing that we should establish a cross-party process, not to kick this into the long grass, but to inform public debate, both about the total level of public funding and also about its structures. But can I make another point? This government has quite rightly, in my view, put an emphasis on independent assessments, inspection, regulation, in order to assess the quality of service that's being experienced by patients across the range of health and social care services. Now, when the evidence that those organisations produce demonstrates that we're delivering less good service than we want to deliver to the people who rely on those services, I think that government should be addressing the evidence about what is happening on the ground, rather than engaging in a rather high-profile discussion about, frankly, what sounds